Howdy. Welcome to Healthcare Ain't Easy with Chris Mathew. I'm Chris Mathew. Today, healthcare can be exciting one day and confusing the next. It can be awe-inspiring or it can be terrifying. With AI now part of the equation, this often leads to more questions than answers. I've spent the last 2 decades navigating healthcare in various ways, and I'll be your guide as we explore how AI and technology in general will impact healthcare and all of us. Through conversations with today's most respected thought leaders, we'll explore where we've been, where we're going, and how it affects the way we live every day. Ultimately, though, healthcare, it ain't easy. It's not easy. It's complicated. We've all experienced and had an experience in this healthcare system. We hope that listening to the ideas that we share will revitalize your optimism in the future of our industry and ultimately its ability to care for humanity. As we continue to explore the challenges the healthcare industry is facing, we know that there are many things we have to figure out, but we also know that communication and collaboration are among the first steps for a successful outcome for all of us. My why, I was really fortunate to read a book forever ago written by the great Simon Sinek, Start With Why. And I was able to go through a Start With Why workshop, which was really powerful for me. And I was able, through a process that they guided us through, I was really able to hone in and nail down my why. And it is spot on and speaks to who I am. My why is to connect with people so that we may boldly contribute to an improved world. If you happen to be generously sharing your time with me and with us today, I want to know, what's your why? Genuinely, I am curious. You can follow us at Sniffle. You can follow me on LinkedIn. I would love to learn, what's your drive? What's your purpose? What's your why? So why I'm here and wanting to bring this creation to you and share this with others, I want to share that with you. My career came from 3 different paths that led me to the seat I'm in today. But before I share those 3 paths, let me give you a little more introduction of myself. I am Chris Mathew, 1T No S. My whole life, I feel like I've introduced myself. Chris Mathew, 1T No S. I am the oldest of 3 sons born to immigrant parents that arrived in the U.S. in the late 70s from South India. Without a doubt, I've won the lottery of life. Given where we came from and where we are today, I've hit it big. There have been many, many people that have shown kindness to us in our journey here, pursuing the American dream, and I'm here to tell you it's real, it's amazing, and it's possible. And I aim to honor those good deeds by continuing to pay that kindness forward. I am proud to be married to a Kentuckian and to be a Kentucky Colonel, which means I can enjoy a bourbon when the time is right. Even prouder to be a father to our boys, and along with my wife, know that we're actively working to make our impact felt for all kids and people and families and communities that deserve to live a healthy life. We are strong. We are brave. We can do this. She'll know what that means. So I started my career after leaving Texas A&M in the physician recruiting arena. I worked for an agency here in Dallas. It was a boiler room environment. For those that have seen the movie, you know that that's an intense environment. It was also a really enriching experience. I learned everything about healthcare. I learned everything about physicians. I learned everything about different specialties and motivations and their desires and helping to guide people on a career path. It was a really intense time, but I had amazing teammates. I had an amazing guide and director who later became a business partner and an older brother to me. He is part of the reason that I get to sit in this chair today. That experience was incredible for so many reasons. But one of the most powerful reasons is that it taught me what I will never do again. It taught me the type of people I don't want to be surrounded by. It shared and shaped me to pursue the path that I'm on and to know why I'm pursuing that path. That led me to 5 startups, all in the healthcare and physician recruiting space, different recruiting models. They all crashed and burned because the business models were flawed. We tried, we practiced, we pivoted, we sweat, we grind, we did it all, but ultimately they failed. Through that failure, though, we failed forward, and I learned a tremendous amount about business, but also about myself. I put myself in some strange predicaments, some strange places, but I persevered, and I found my way through, and I'm definitely here because of those failures. My 6th pursuit was a success, and a few others that allowed me to join them in a new physician recruiting concept, and I got the opportunity to help lead this organization over the course of 13 years. By far, that is the most fun professionally I have ever had. It was amazing. We took a very commoditized industry and space, and we created something unique that really served the true stakeholders. That experience led me to where I am today. That experience also gave me the opportunity to become a co-founder for a bespoke digital marketing agency with a true digital ninja partner. I learned the power of digital marketing to specifically guide and influence desired outcomes. I figured out ultimately, if you can access the data, and second of all, interpret the data, then third, you can always guide towards the outcome you're pursuing. This digital marketing experience blew my mind in lots of ways, and again, is one of the reasons I'm able to sit in this chair today. My childhood best friend has been working in employee benefits for 12, 14, maybe 15 years. But for 10 years, he was telling me about this place called employee benefits and how amazing and how much of a hidden secret it was. So after 10 years of him chirping in my ear, I decided, all right, maybe I'll take a look. We both got the opportunity to live a childhood dream, which was we got to be in business together every day, working together for 3.5 years. It was amazing. We worked for our director here, very strategic thinker, wanted to apply disruption to an antiquated, commoditized industry. It was amazing. My experience with this carrier, a global carrier, biggest business I've ever been a part of. Here I am, nothing but startups, my whole path, and I joined a global insurance carrier. And one that really still, although it was a huge organization, had the ability to make a personal touch. It was an incredible experience. But what it really helped me understand is how complicated and sometimes overly complicated insurance and health insurance and ancillary insurance really can be. That experience allows me to be in my seat today. But those experiences of healthcare recruiting and digital marketing and the employee benefit space led me to where I am today, which is a calling, I feel, to be the Chief Growth Officer with Sniffle. Sniffle is an AI-driven virtual care ecosystem. Better care, bigger picture. Sniffle is going to allow people to live healthier lives and lower healthcare costs at the same time. This isn't just a purpose. This is an action. This is a movement we're creating. When we say better care, it's not just better care for physicians or patients, but it's both. It's for the clinical workforce and our communities. And the reality is that we can, through the power of AI and with advanced technologies, we can serve the real stakeholders of healthcare, the clinical workforce and the patient community. We have found purpose for AI. We've created medically curated AI to help people really have visibility into their health journey. And we've had the ability to create and craft AI to help source solutions that support individuals and families and communities through their overall congruent healthcare journey. This really matters to me because of my dad. I lost my dad in 2012. And in that experience, I longed for something that didn't exist at the time. My dad had gone to see the doctor 3 times in about a 10-day period of time, a 10-day window. And every time he went to the doctor, he was complaining of really feeling pretty terrible. First time he went, he said he requested an EKG, and they found a right bundle blockage. But the physician dismissed it and said, 20% of people are walking around with it, not a big deal. Now, my dad was over 65, was a diabetic, on blood pressure medicine, complaining of chest pain, and a right bundle blockage was found. Hindsight, but my dad should have been sent to the hospital. The second visit, he was sent home with indigestion and some really powerful pain medicine, and he had a really bad cough, but he felt really terrible. He went on the third visit, 10 days after that first visit, when they discovered that right bundle blockage, and at the third visit, they couldn't find his pulse. They still sent him home. That evening, my wife and I were having dinner, and I called my dad, and he didn't answer. He just he sent me a text and said, "I'm just too tired to talk. I just feel terrible. I feel like I'm dying." I wrote back, "Dad, you're not dying. You're okay." And within the hour, my mom called me and said my dad had had a heart attack. My dad trusted his physician. He had a very long relationship with his physician. I support that. Continuity of care and relationship with your provider, with your physician, with your clinical team, that's really important. But if we would have had the tools that we have available today, then maybe we would have relied on a little more than just one opinion. With Sniffle, we have a really powerful tool. We call it our diagnosis tool. We firmly believe that a diagnosis can only really be delivered and should only be rendered by a licensed medical provider. I stand to support the medical community. Their expertise should not ever be usurped. But an diagnosis is an AI-derived diagnosis. Our diagnosis is built upon 14 million patient visits and encounters. And so when an individual puts in their family medical history, their lifestyle, and their chief complaint, it's going to lead them through a medical interview. And that medical interview is going to return a set of differentials, and those differentials have a 95% accuracy rating. That's really powerful that people have the ability to have true visibility to what's happening in their world. At that point, it's up to the patient what they want to do. The digital triage may suggest you should book a virtual appointment. You hit a button and you schedule an appointment with your provider, not a random provider. We do not believe in transactional script care, right? Random doctors seeing random patients, that is not what healthcare should be, at least in our opinion. But if you hit a button and you can schedule an appointment with your doctor, fantastic. Maybe your doctor isn't on the Sniffle platform. That's okay. You can send an invite to your physician and say that you want to start seeing them on Sniffle. The digital triage may come back and say, do not schedule a virtual appointment. Very quickly and safely get yourself to the hospital. Get yourself to the emergency room. Hindsight is what it is. I don't know that diagnosis would have saved my dad, but I do know that diagnosis can make a major impact for communities and families and people all across the country. And that's what we're bringing to the market. That's what we've built. That's what we've created with physicians alongside us from the start. Our solution, our platform, has been created and curated by the medical community. It's been built with physicians and clinicians and administrators from the start. We're bringing a solution that's going to empower people to live a long, healthier, more cost-effective life, because healthcare ain't easy and it ain't cheap. It's expensive. And there's a lot of solutions out there that make that more complicated than it should. But what we're proud of is that Sniffle's bringing a solution that we believe is really going to support people and really pursue their opportunity to save dollars and to pursue access of great care in their health journey. So we're going to bring these incredible solutions to the market because humanity deserves to know and not wonder what's going on with their health. We're here to play an important role, and we invite you to come alongside us. This is for our friends, for our families, for our communities, for my dad, maybe for your family, who all deserve better care. Healthcare ain't easy, but through these conversations, we're going to explore how we can make it better together. Follow us on our different social channels, and I am grateful, so grateful that you would share your time with us and our team here at Healthcare Ain't Easy. Talk to you soon.